Good afternoon. Thank you for joining us for this news conference, this COVID update. This one's going to be a little bit different. We're going to provide updates regarding local responses to COVID-19. We're going to discuss and sign the legislation that passed this week calling for voter referendum on the half-cent sales tax for our local schools. And on the other side of me signing that bill, we're going to talk about next steps in our community as we begin to look forward into the month of May. Joining us on the call today is Sheriff Mike Williams, Duval County Public Schools Superintendent Dr. Diana Green, School Board Chair Warren Jones, City Councilman Matt Carlucci, City Councilman Tommy Hazzuri, City Councilwoman Brenda Priestley Jackson, Fire Chief Keith Powers, and our Emergency Operations Center Director Steve Woodard. Thanks everybody for being with us today. For the first part of this briefing, let me share the latest number from the Florida Department of Health. As of this morning, the Department of Health is reporting 769 positive cases in Duval County, 67 hospitalizations, and 14 deaths. Our percentage of positive test results continues to be at between 5 and 6%, 5.3% to be exact, which continues to trend below other large metropolitan areas. My team and I continue to monitor the information and our executive orders every single day to decide whether further action is needed or whether it's time to start to scale things back. I want to say that I am proud of the community and the way that you've all reacted. I know that most people have taken this seriously, practicing social distancing. Many are wearing masks when they're in grocery stores and out getting essential items. And I want to thank you for that. I believe that you've made a difference. As it relates to what's happening in terms of the curve, I want to point to you a basic graph with two sets of data. The graph to my right over here. The orange line on this chart represents the number of the positive test results to COVID-19 in Duval County. The blue line is the number of hospitalized COVID patients. You can see the orange line has a lot of fluctuation. While we watch this line closely, the focus here isn't necessarily on the number of positive cases, it's the percentage of positives. For weeks now, only 5% of those tested have come back with a positive result. Now let's take a look at the blue line. This represents the number of people hospitalized in Duval County. This is the curve. When we talk about flattening the curve, this blue line is our focus and what we need to flatten. Though it has some fluctuation, if you look at the center, and then you look to the right, the data seems to indicate we are near our peak in hospitalizations at a level manageability below our local capacity. That consistency for the last 2 weeks appears to be flattening what we need, and we've worked so hard as a community to achieve. The data we record over the next week or so will continue to tell the story. To recap, the blue line appears to tell us we are succeeding in our mission, but we can't give up until we know for certain within the next week. Continue to social distance, go outside for essential tasks, grocery stores, and wear a mask in public spaces. Take care of each other. We're going to get back to life. We just got to be patient, pay attention to this over the next week, and look forward to how we move forward in the days ahead. So far in our partnership with ViStar, approximately 240 small businesses have been approved for over $8 million in COVID-19 relief loans. These numbers sound great, but remember, these are faces and real people behind these numbers. My team and I received some positive feedback from many companies, including Joe Padlow of Veterans Elite Services. Thanks to this small business loan program, Mr. Padlow was able to rehire his employees and keep his business running. He called them this morning to tell them they were rehired. So this small business relief is having real impact on businesses and people's lives that are taking care of themselves and families. I know there are many businesses and employees struggling, and we hear you. We are continuing to work with our local, state, and federal partners on solutions. I'm going to move to our school tax referendum right now, but I want to encourage your viewers to stick around because when we come out of signing this legislation on the other side of this, we're going to talk about steps forward in the days and weeks ahead as we think about the direction we're going to head as a community. Earlier this week, City Council passed Ordinance 2020-161, which authorizes a referendum for a half-cent sales tax that will help bring all of our public schools into the 21st century. I'm grateful for the leadership in collaboration from Dr. Diana Green, City Councilman Matt Carlucci, Councilman Tommy Hazzuri, and Councilwoman Brenda Priestley Jackson, and School Board Chair Warren Jones on this important effort. I'll sign that legislation this morning and look forward to fully supporting this referendum in the fall. But before I sign it, I want to give my colleagues an opportunity for a few brief comments on this issue. Dr. Diana Green.
Thank you, Mayor Curry. I would be remiss without stating a quote from Jesse Owens. He said, "We all have dreams, but in order to make dreams come into reality, it takes an awful lot of determination, dedication, self-discipline, and effort." And the Duval County School Board, we started this journey last year under the direction of former School Board Chairwoman Lori Hershey, and now at the signing today with Chairman Warren Jones. This referendum is about schools and students, and now it's about much more. It's now about the economy, and it's about future jobs and getting our community back to work. Up to the election, we will do everything we can to answer questions and educate the public so every voter can make an informed decision. If this referendum is approved, our Citizens Oversight Committee will maintain our transparency with the community. There really is a benefit for everyone: property values, jobs, and of course, better, safer schools for teachers and students. I'm thankful to the school board, the mayor, and the city council for coming together to give Jacksonville the choice and the chance to achieve a great outcome for our community. Thank you.
Thank you, Dr. Green. School Board Chair Warren Jones.
Thank you, Mr. Mayor, and thank you for your support of the district's bold plan. I also want to thank our dynamic, innovative, and creative superintendent and Dr. Diana Green for proposing this bold plan. Thank Terry Brady, president of Duval Teachers United, parent organizations, school advisory councils, many stakeholders, and the thousands of residents who participated in the over 20 community meetings we held last year. We couldn't do it today, unfortunately. Also, thanks to our school board members who voted to support this bold plan. And finally, we got to realize that this is about children and improving the outcomes of our students. By providing a 21st learning environment, we have over 121 schools that are 50 years old or older. We know that, and we know that that environment is not the best for our students. We don't have impact fees, we don't have a sales tax, we don't have a millage increase, but with the passage of this today, I think the citizens are poised to improve not only our economy, but also the academic success of all of our students. Thank you, Mr. Mayor.
Thank you. Councilman Carlucci.
Thank you, Mayor. First, I want to thank you on behalf of so many in your emergency operations team for your leadership through this terrible time in our community. And I just felt it was appropriate to thank you for that. But I really want to thank you for your strong leadership and support and quickly signing what I think is landmark legislation for the half-penny referendum into law. And I really appreciate being invited to participate in what I think is a historic day in Jacksonville's history. The foundation of great cities is having great schools. We all know that. And it's time for our students to learn and our teachers to teach in safe and secure learning environments and to also learn and teach in 21st century schools. But I also want to say, in addition, that when the half penny becomes effective, it's going to create thousands of jobs in our community through the building and remodeling of our school facilities. But you know what I particularly like, Mayor, is I like the way that the city and the school system is partnering together now. And I've always said that Jacksonville moves best when we move together. And that's exactly what we're doing today. Thank you very much for this opportunity.
Thank you. Councilman Hazzuri.
Thank you, Mayor, and to all my colleagues, and absolutely to thank our first responders, the mayor's leadership during these past many weeks of this pandemic. But you know, during this time, good things still happen, and I think this is huge for our kids and our K-12 education system in Duval County at every level. I want to thank our public officials and our community leaders for never stop believing in our children. The magic, as I've always said, the magic is still in the classroom. Now's the time. Now's the opportunity to give our children, our parents, our teachers, and staff a safe and healthy environment. Now's the time, I believe, for us to all stand and deliver on November 3rd. Thank you very much, Mayor.
Thank you. Councilwoman Brenda Priestley Jackson.
Thank you, Mr. Mayor. I appreciate your collaboration, Chairman Jones, members of the Duval County School Board, Dr. Green, and my city council colleagues, our Jacksonville neighbors, students, parents, and teachers in advancing and supporting Ordinance 2020-161 for a voter referendum on November 3rd, 2020, levying a local option sales tax for school capital facilities. And so what's behind those numbers? We're talking about 130,000 students in Duval County, 118,000 in traditional public schools, and about 12,000 in charter public schools. What we are committing to do is to make certain that our schools maintain world-class public facilities, public schools, and high-quality education. That has been a long time in coming. I am grateful for the collaborative spirit that we have all brought to this at long last, and I truly believe that we are stronger together, and we will truly have a plan that addresses all of our young people's needs. Thank you again for including me, Mr. Mayor.
Thank you. We're going to make it law. Thank you. Thank you all again for joining us on this call as we sign this legislation today. As I've consistently said, the decisions that we've made as a city over the last few weeks have been influenced heavily by the expertise of healthcare professionals. I want to take a moment to thank those who have been important and dedicated advisors to me and to those people that work around me through this pandemic. Brad Talbert with Memorial Health Systems, Brett McClung with Baptist Health Systems, Dr. Kent Thielen with Mayo Clinic, Dr. Leon Haley with UF Health, Tom Van Osdal with Ascension St. Vincent's, Doug Baer with Brooks Rehab, Captain Matthew Case, Naval Hospital, Dr. Matt Rill with Telescope Health, who assists with one of the city-run facilities. This team has been invaluable thus far in helping make crucial, life-saving decisions. I appreciate that and I'm going to continue as we move forward to collaborate with them in the weeks, days, and months ahead. Next week, I will be announcing the formation of a similar group of local leaders who I'll rely on to help me chart a course to safely reopen our city and get our citizens back to work. I'd like to add that I've been in contact as recently as this morning with our beaches mayors and others. We're discussing the possibility of a limited reopening of beaches and parks for exercise purposes. For now, they remain closed, but this is something we are continuing to discuss today and through the weekend. As we prepare to go back to work and look to scale back some of the restrictions of the executive orders, I want to remind folks that we are under a stay-at-home order by Governor DeSantis. My team and I are working closely with him in his office and reevaluating my executive orders to chart a course forward to get people back to work. I look forward to getting everyone back to work. And again, I want to say to the community, I appreciate all that you've done and continue to do. This will be our last scheduled news conference until Monday. Of course, if there are any important updates or information to share, we will schedule an update. Before we go to questions, a few reminders. Make a call to someone at 7 p.m. tonight. Talk to them, listen to them, share with them. You'll touch somebody's life and yours will be touched as well. I want to also remind everyone to be mindful of those struggling with depression, alcohol and drug abuse, thoughts of suicide in these hard times. If you know someone who struggled with these issues in the past, please check in with them and let them know that you care. We have a list of resources available on the city website at coj.net/recovery resources, and the National Suicide Prevention Hotline is available 24/7 for those in need at 1-800-273-8255. With that, we'll take questions. Jamarlo with Action News.
Hey, good afternoon, Mayor. Hey, so the state has maxed out on its bridge loan program, pretty much ran out of money. So I know that you mentioned that 240 small businesses have been approved for loans with the city and ViStar. Can you tell us how many small businesses have been denied loans? And how long will this partnership last with the city and ViStar?
Well, I can tell you that the approval rate is, I don't have the stat off the top of my head, but I got an approval rate a couple days ago, and it's been pretty significant. ViStar understands the importance of this crisis that we're in, and their underwriting requirements. They really have exercised, I don't know if leniency is the right word, but the ability to process people quickly and make sure they have access to funds. This partnership will continue. We'll always continue to reevaluate it, but we're in part one of the partnership, we're in it for the long term because these loans are going to be 5-6 year loans, but we'll always be reevaluating other ways we can provide relief to people. As I said in my comments, throughout this pandemic, I have been on regularly scheduled calls with the healthcare professionals that I mentioned, and then individual calls where we would talk through public safety, how to make decisions. I will be doing the same thing with another group of people that I will work with as we move to reopen our city in a safe way and get people back to work. Jim with WJXT.
Well, Mayor, lots of new information today. Two questions, one on reopening the city, and then the second is going to be changes at Lot J today as well. But on reopening the city, you said that you'll talk to the beaches mayors, and there's a possibility. I understand that. But when were you thinking of maybe reopening the beaches? And then let's look a little bit ahead to the future here. I know you've canceled the Jazz Festival. Other events have been canceled. We're talking, with July 4th even coming up. What do you see happening there? But let's first off talk about the beaches. And then I understand at Lot J today, they've increased the testing up to 750 people as well.
Let me answer that. Let me go back to the previous question. Over 70% of applicants to ViStar have been approved. So it's a significant number of providing relief to businesses and employees. Don't have a date for reopening beaches and parks, but what I can tell you is we had a very good conversation this morning, and we will be again tomorrow talking about how now that we appear to have flattened the curve, how can we responsibly provide some access for exercise and movement, the ability to social distance in our beaches and our parks sooner rather than later. Just don't have a date at this time. In terms of the Jazz Fest and concerts, when you look at places where there has been rapid spread and significant death, seems to be a lot of high dense people together for long periods of time. So at least for now, in the short term, I don't foresee any large concerts or large events in the month of May. We're always going to reevaluate. Every day we're going to reevaluate what's happening. But we just have to be responsible and smart about this and, social distance when we can. I would remind you that one of the first things we did before we even had stay-at-home and work-from-home orders was first action was shut down theater and concerts and all stuff that would have put large groups of people in seats next to each other for hours, which would not have been advisable then and is still not advisable now. Shelby with First Coast News.
Good afternoon, Mary. I have two questions for you. The first one's kind of going back a little bit to the beginning of this and just asking you, when did members of the White House and the governor's office initially reach out to you about preparing for COVID-19? And was it soon enough? Were you looking for communication from them before that time when they reached out initially? And my second question, can we expect any more improvements or resources for individuals who are still trying to file for unemployment and having difficulties?
Gosh, there's been so many conversations with members of the White House, with the governor, the governor's team. It's a blur. I mean, there's been a lot of communication. So let me speak first to our governor. Yes, I spoke to him yesterday at length, in regular contact with his chief of staff, get him on the phone when I need him. Was able to keep the federal testing site up and running as a result of him specifically. I mean, there's a whole host of issues. The help with the field hospital we were potentially going to need. So yeah, getting what we need. Early on, when all this started, I was on the phone with a member of President Trump's team, the White House, and I had hospital physician experts telling me that we needed to be thinking about capacity in the event we got into a rush on hospitals. And I said to this person, you know, we're thinking about capacity, and we were slated one of the first federal field hospitals where we didn't need it. So yeah, I have the access and the resources I need from our president, his team, and our governor. The other part of the question was
the unemployment. Will there be
talked too much? I forgot it.
resources that you're aware of to help individuals who are having trouble?
Yeah, I know that and I've been told there's been progress in that area. I know the governor's team, and he has ordered that they work rapidly to get the system operating, and I'm told they've had some results there to get people the funds and the dollars they need. Mike with the Daily Record.
Yes, hi, Mayor. Can you tell me a little bit about your selection process for this advisory council that you'll be forming to reopen the city, and kind of what have you reached out to? Who specifically have you reached out to yet? And what kind of a team are you looking to put together?
Yeah, well, we'll finalize that either over the weekend or early next week. I haven't finalized yet, but there's a number of things we need to do. One is when we reopen, we open in a way that is safe. And what that looks like will probably include testing and a number of other public health things. So it's important that that I continue to have conversations and advice from medical professionals and experts as I've had through all of this. The other piece is, government. What projects does the city of Jacksonville have in our CIP and other things that are neighborhood specific that we've got in our timeline to do in our CIP over a number of years? And what kind of those projects can we maybe move forward, because they need to be done anyway, and get people back to work. So folks that can help and advise with that. And then also folks from the business community that have the experience leading organizations and can help talk to me about the types of things the city can do in terms of the regulatory environment or fees that people pay, so we can provide the relief that we need to get the city back to work in a way that is safe. Jim with WJXT.
Mayor, I just kind of wanted to follow up a little bit. Lot J, we understand today they are now testing 750 people, up from the 400. But we've also been seeing in the results that come back from the state, there's really not a racial breakdown here where we see in other parts. I think 58% of those, or 56% of those tested here in Duval County, they really haven't been able to specify with race. And we know that that's kind of been an issue with the African-American community, which has been testing more positive. I guess this may be a question for Director Woodard or the chief, but what is going on with the testing? Changes at Lot J, do we see now with more people being tested that we could see those maybe that aren't symptomatic at all being tested? What's going on with all of that?
Director Woodard, you want to take that?
Yes, sir. Thank you, Mr. Mayor. Jim, as you know, we had a really smooth and seamless transition at Lot J from a federal testing site where the city had significant responsibilities. We helped operate that site for 25 days and were able to test over 5,000 people. The men and women of the National Guard have now taken over that site. It is a state testing site, and they have conducted, as of 12 o'clock today, 95 tests. Because of the restrictions that the federal government had placed on the site for number of tests, now that it's a state site, we do not have those restrictions. Depending upon the demand, the state and the labs do have the capability to test more people. They would like to get to 700 a day, but the target really, of at least 400 is a good target. But once again, we've only tested 95 people as of 12 o'clock. As far as the breakdown of the demographics of those tested, those numbers are available now through the Department of Health on their website. I'll refer you to that. For us, it doesn't look as having as much disparity as there is in other places, but would refer you to the Department of Health site for those specifics.
Megan with Action News.
I'm muted. Am I good? I have another question related to testing. So I know that the National Guard has taken over and that's not the city's place, but for the last 3 days, weather has played such a big role in the delays of testing. And I understand we have the capacity to test about 400 each day, but in the last 3 days, not including today's numbers, we've only tested really about 260 people. Do you think that this testing site is really being used to its full potential? I know that just the weather has been causing a lot of issues there.
Look, so Lot J isn't the only testing site. There are numerous options to be tested in the city of Jacksonville. Lot J was set up as a supplement to give people access, a convenience aspect to it where you can pull up in your car. With the convenience aspect, you face things like weather, and the National Guard, in collaboration with our team working out there, are making decisions when weather comes in that's in the health and safety of the people providing the care or the tests, and they need the tests. But there's the Prime Osborne Center with telescope testing, the Department of Health, St. Vincent's, all the hospitals. You can call your physician. There are a number of options for testing. When Lot J can run safely, it will run and it will test people. Shelby Danielson.
I have a question for the sheriff, if you don't mind. And we've just, we've just heard from concerns from different people about domestic abuse being on the rise and, not being able to get out of your house, obviously. Is this something that you have your officers out addressing? Have you tried any new ways to make sure that this doesn't become a bigger problem with people being forced to stay at home?
So thanks, Shelby. Actually, domestic violence issues in the community, our calls for service related to that are up about 20%. And that's obviously a direct result of the quarantine of people, spending that extra time together. Unfortunately, we're just making sure that as officers respond to those initial calls for service, that they're spending a little extra time to make sure that those issues don't escalate. And so really at that point, those couples go back into their homes, and we're hoping for them to make good decisions there, and so that we don't have to be involved. But yeah, we're spending a little extra time on those calls again to make sure that we're intervening at that early stage again to make sure that these situations don't escalate.
Okay, so that's it for questions. I want to thank everybody, and again, as people head into the weekend, I just want to remind them that Governor DeSantis yesterday was talking about his plan to move the state back to getting back to work in a way that's safe, which includes testing. I am in communication, contact, conversations, and collaboration with the governor and his team. So I want people to know that plans are being worked out so we can move timely to get people back to work in a way that's safe. Thank you and have a great weekend.